This may cause some controversy in the office, but I'm a proud graduate of Louisiana State University. Go Tigers. I graduated with a degree in biology in 2016. And after graduation, I pursued my optometry degree from the University of Missouri, St. Louis. My family has a large presence in the healthcare community, everything from doctors to nurses, even hospital administration. So I always knew that I wanted to be in the healthcare field. And it wasn't until I was an undergrad that I shadowed an optometrist, and I became completely enamored with the visual system. And ever since that day, I've known that optometry was my path. The doctor-patient relationship to me is a sacred bond. The field that I've chosen for myself gives me the opportunity to develop lifelong relationships with my patients. But with that kind of comes a certain give and take. I have to trust that my patients are being open and honest with me regarding their health system and their visual needs, but I also need my patients to trust me that I'm going to do everything in my power to deliver the best possible care that I can. My advice for those seeking specialty contact lenses is that a specialty contact lens exam can be vastly different than a standard contact lens exam, in that it can take weeks to even months to reach an endpoint where both myself as the doctor and you as the patient are satisfied with the endpoint. This is another point where openness and transparency come into play. I can only see what objectively I was trained to see, so I need the patient to tell me exactly what they're experiencing. So I may be a little biased, but if given the opportunity, I feel that most patients would choose to spare their vision over all the other senses that we have as humans. And I take great pride in teaching patients those preventative measures to prevent diseases like macular degeneration and glaucoma from taking their vision. But our medical training goes far beyond the eye. The eyes are essentially a window into viewing many other systemic diseases that can take hold of the human body, such as diabetes and hypertension. So some days as an optometrist, we're doing more than preserving vision. We're also saving lives, and to me, that's pretty darn cool. I'm an avid outdoorsman. I really enjoy hunting and fishing, and I'm not too shabby with a golf club in my hand. I have two dogs named Charlie and Macy. I married the love of my life in 2020, and we're expecting our first child in January of 2022. I'm super excited to be part of Southern Eye Group and to become a member of this community.